Hey guys, I know you've heard about kids getting really sick with a multi-system inflammatory condition that we think may be linked to COVID-19. I know it's scary. I thought I would come and talk a little bit about that and symptoms that you need to be on the lookout for. Now, this is not to scare you. This is to make you educated and aware and informed and what we call extra vigilant. These are just things that you need to look out for and be mindful of. Again, this is rare. It's not happening certainly in a large proportion of children, but we are seeing severe illness in some kids that we think might be linked to COVID-19. Now, why is this a change and why is this a big deal? Well, any illness for anyone is a big deal, but we also know that kids seem to have been spared from severe illness from COVID-19 thus far. Thank God for that. But now we're seeing this influx in illness that sounds like an inflammatory like illness. And it's really kind of catching us doctors by surprise in many ways. There's a lot to learn. Okay, so let me go through the symptoms, all right? So what doctors are finding out, they're seeing kids that are coming in with symptoms that overlap the symptoms of toxic shock syndrome and Kawasaki's disease. Now, those are two conditions, inflammatory conditions. I'm going to tell you about Kawasaki disease because I want you to understand the symptoms that some of these kids have presented with so you can keep an eye out, okay? Kawasaki disease is not a new condition. It's been around a long time. 80 to 90% of kids who have it are over the age of 6 months, but younger than 5 years old. And the symptoms that they tend to have are a fever that lasts for a long time. We're talking like greater than 5 days. Red eyes, or what we call conjunctivitis, irritated eyes. A pink rash all over the body. Rash is kind of what you're looking for. Red, dry, cracked lips. Something that we call a strawberry tongue. And we say this because it kind of resembles what a strawberry. A white coating on the tongue with red bumps on the tongue as well. That's a strawberry tongue. These kids often get sore throat. They also may get swollen joints, that's swollen hands, palms, soles of the feet, very important. And they can also get swollen lymph nodes in the neck. Usually that's right about here. Now, kids can also get peeling skin, okay? Peeling skin, joint pain. They can also have belly symptoms, diarrhea, vomiting, belly pain. But the thing about Kawasaki disease is that it's a condition that causes inflammation of the blood vessels anywhere in the body. But blood vessels in the heart can also become inflamed as well. And it can definitely affect the heart. Some kids with Kawasaki disease end up having aneurysms or irregularities of their heart in terms of how the heart beats or problems with the heart valves. Again, these are symptoms that are being seen in some of the kids presenting with this multi-system inflammatory condition. These symptoms that we've seen in Kawasaki disease, which I just mentioned, and that may be possibly related to COVID-19. This is not for you to become paralyzed with fear. This is not to scare you. It's just to talk about what symptoms you may be on the lookout for. And this is what I would say, guys. For all of you parents out there, and for those of you who are family members, trust your gut. If your child doesn't look right, they're not acting right, they're not behaving right, they're not urinating, eating, drinking, doing all that stuff the way they should, you need to seek medical care. It's always best to be safe than sorry. And I know a lot of people are forgoing going to the ER because they're afraid of COVID. The thing about it is if you have an emergency on your hands, you need to go to the ER. That's not just for kids, but it's for adults as well. Guys, I hope this is helpful. Please share this video. And also, if you're interested in sending stars, I will be answering your questions first. Guys, I'm Dr. Jen Caudle. Thanks for joining me.